Well, we believe that every nurse is an educator. And so, because we're all nurse educators, what we want to do is really embrace the opportunities that we have to educate our patients, even our fellow colleagues, making sure that we embrace that experience by building a solid foundation of knowledge. So that's where it has to start. So some really is taking an honest look, doing a self-assessment of where your knowledge gaps are as it relates to the conversations you're having with patients, as an example, or the gaps that you have as a charge nurse or as a preceptor, or maybe you're interested in becoming a critical care nurse educator or an educator in your hospital setting. So that's the first step, is just doing a self-assessment about where your knowledge is today, what your knowledge gaps are, and then how are you going to fill in those gaps to help bridge what we call the theory to practice gap. So ultimately, we want to take a look at what the evidence says about our patient care practices, about our educator practices, and then we want to figure out, how do I implement them? So how do I move to that next level so I can achieve that highest level, which is expert? So I would say first and foremost is thinking about where you are today from an experience standpoint. And then that second step is formal education, because the need in academia really is to have that master's prepared nurse educator. So that's what I would encourage, is looking at educational opportunities for you to advance your education as the next. And then that third step is really what we do here at Dr. Sellars Educate, and that is that we coach and support and guide other colleagues across the country to help them achieve success. And a big step in that process is making sure that we're developing that relationship. Having a trusting relationship with the mentor or with the coach is critically important.